right, Dr. H here. Today we are again shore fishing on Big Bear Lake, and we're taking this opportunity to have a little discussion for Physio on the Go, where we are dealing with shunts in the cardiovascular system, especially in the heart. Okay, and so we were having a discussion last time about left to right versus right to left shunts. The key point being left to right shunts, blood going from the left side to the right side, results in oxygenated blood going back to the lungs, but not deoxygenated blood going out to the body. Not efficient, but what we're worried about is when we have deoxygenated blood going from the right side to the left side and then out through the aorta and out to the body. Okay. We also said, why is it that it's usually left to right? Because there's a higher pressure on the left side than the right side under normal conditions. Okay. So what could cause things to flip around? Well, let's just use a ventricular septal defect as the example. So here it would be a defect in the septum between the right ventricle and the left ventricle. There should not be connections between the right side of the heart and the left side of the heart that don't go either through the lungs or through the systemic circulation. Okay, so there is in this case an opening. All right, so initially what would happen? Blood would go from the left side to the right side, and we would have a left to right shunt because the pressures are higher in the systemic circulation than the pulmonary circulation. Okay, so we would be sending some oxygenated blood back to the lungs, but not deoxygenated blood out to the body. And we would do this for a while. Okay. Now, the problem with doing this is high pressure. The left ventricle has highest pressures in the system. So we're going to put pressurized blood into the pulmonary circulation. Right, so we're sending pressurized blood into the pulm, way more pressure than is used to being sent to the blood vessels in our lungs. Right, so this is going over here to a lung, and this is going over here to a lung to get oxygen. Okay, and so usually those blood vessels are under low pressure, but if we put a lot of pressure, if we push on these things, put a lot of pressure in these blood vessels with that extra oxygenated blood that we're sending that way, then what's going to happen is those blood vessels are going to try to adapt to that high pressure and start squeezing down to cut down the pressure coming into the lungs. All right, boat just went by, so we're going to pause for a minute and then we'll get back after it in a sec. So we'll just take into view until the next set of waves comes in. All right, not too bad. So, key point, if we send a lot of pressurized blood into the lungs, that is going to cause the blood vessels in the lungs to remodel. Yeah, and narrow and increase their resistance, trying to handle those pressures. Okay. So, if the pulmonary circulation starts to become narrowed with atherosclerosis and other kinds of remodeling that happen when we put too much pressure into the system, the resistance starts to increase in the pulmonary circuit. Usually the resistance in the pulmonary circuit is way less than it is in the systemic circuit, which is why we have to have more pressure on the left side than the right side. But if the resistance keeps going up, and if we keep sending more pressure in there, that is going to make the resistance more, and that's going to get more pressure and more pressure. Eventually, the pressure on the right side of the heart will exceed the pressure in the left side of the heart. This is something called Eisemenger's syndrome. Okay? The net result is what we had at the beginning was a left to right shunt sending oxygenated blood. Now it was pressurized blood, but oxygenated blood to the lungs. If this goes on too long, it's possible for this to turn around, and a left to right shunt becomes a right to left shunt. This is Eisemenger syndrome. And mostly that happens when we send pressurized blood into the lungs. And now the problem here is we are sending deoxygenated blood to the left side, which is going to head out the aorta and to the body. And so this is going to result in cyanosis and hypoxemia out in the body. Okay? So this is known as Eisemenger syndrome, where you convert a left to right shunt to a right to left shunt. And the problem with doing that, of course, is now we are sending deoxygenated blood out to the body as opposed to just sending oxygenated blood back to the lungs. Anytime we have deoxygenated blood going into the left side anywhere along this system, that is going to result in deoxygenated blood going to the body, cyanosis, and hypoxia. And of course, cyanosis just means someone is going to start to appear blue from the quote-unquote blue blood. Okay? That was a quick one, just knocking out switching left to right shunts to right to left shunts, which you don't want to do, but this is known as Eisemenger syndrome, and the key point is that that happens when pressurized blood goes into the lungs for an extended period of time. Okay, I think we'll wrap this one up here and pick up again with several particular shunts and what we have to worry about with each of those things. Okay, take care and God bless.
Thanks for watching Physiology Fundamentals with Dr. H. Please like and subscribe, and don't forget to get outside and go for a run.